What if the very medical system designed to save you is now the single greatest threat to your quality of life? Welcome, my friends. Professor Vitalis here with your daily dose of wisdom and wellness, where science and experience walk hand in hand. Most people believe that when it comes to medical tests, more is always better. But today I'm going to challenge that fundamental belief. The truth is, after a certain age, some of the most common screenings can unleash a cascade of harm that far outweighs any potential benefit. This isn't about fear-mongering, it's about empowerment. It's absolutely crucial that you stay with me until the very end of our discussion today. Because after we've examined these 5 specific tests, I will reveal the single most important conversation you must have with your doctor. This one conversation can shift your healthcare from a standardized, outdated protocol to a plan that truly honors your body, your wisdom, and your precious years ahead. This is the key that unlocks truly personalized medicine. Let's begin. We are living through a quiet revolution in medicine. For decades, the prevailing approach was one size fits all. We applied the same rules, the same tests, and the same interventions to a 45-year-old as we did to an 85-year-old. But a growing chorus of physicians, especially those like myself who specialize in the science of aging, are now acknowledging a profound truth. This approach is not just outdated, it's dangerous. In our later years, our bodies are not the same. Our priorities are not the same. So why should our medical care be the same? Today, we will pull back the curtain on 5 specific medical investigations that you should seriously question and perhaps refuse after the age of 70. These are the very procedures that many knowledgeable doctors quietly opt out of for themselves and their own elderly parents. We'll explore why they are so commonly recommended, the hidden dangers they carry, and the safer, more intelligent alternatives that exist. You deserve medical care that respects your age, not just fights it. Number 1. The colonoscopy trap. For decades, colonoscopy has been heralded as the gold standard for preventing colorectal cancer, and for good reason. In our 50s and 60s, it is an incredibly powerful tool that has undoubtedly saved countless lives by finding and removing precancerous polyps. But what no one tells you is that after age 70, and certainly after 75, the risk-benefit equation flips dramatically on its head. The procedure that was once a lifesaver can become a source of significant risk, stress, and even life-altering complications, especially if you have no symptoms and no family history of the disease. Why does this happen? Let's first consider the procedure itself. It is far from a simple checkup. It requires a rigorous and complete bowel preparation, the administration of powerful sedative drugs, and the invasive insertion of a scope deep into your colon. This is a significant physiological stressor, even for a young, robust individual. For an older adult, the risks multiply. The bowel cleansing process, which involves drinking large volumes of a strong laxative solution, can lead to severe dehydration and dangerous shifts in your body's electrolytes, like sodium and potassium. For an older heart and kidneys, this can be a perilous shock to the system. Then, there's the sedation. As we age, our liver and kidneys process medications more slowly. This means sedative drugs linger in the system far longer, often leading to prolonged confusion, dizziness, and a significantly increased risk of falls in the days following the procedure. A fall, for an older person, is no small matter. It can be the beginning of a cascade of complications, from a broken hip to a loss of independence. But there is an even more insidious danger. During a colonoscopy on an older individual, it's not uncommon to find small, benign polyps. These are often extremely slow-growing, taking 10, 15, or even 20 years to potentially become cancerous. If you are 78 or 82 years old, the simple and statistical reality is that you are far more likely to pass away from other, more immediate causes long before that tiny polyp ever becomes a threat. Yet, the moment it is found, it triggers a powerful fear response. This single finding can launch a chain reaction of further interventions, biopsies, repeat procedures, and sometimes even major surgery to remove a part of the intestine, all in the name of prevention. But when the risk of the intervention itself is greater than the risk of the condition it's trying to prevent, it is no longer prevention. It is harm. I will never forget a man I knew named George. He was 82, sharp as a tack, and enjoyed his daily walks. He had no digestive issues whatsoever, but his doctor recommended a routine colonoscopy. During the preparation, he became severely dehydrated. After the procedure, he was weak and disoriented. That night, he fell in his home and fractured his hip. That one preventive test, which ultimately found nothing, led to surgery, months of painful rehabilitation, and a permanent loss of his cherished independence. The medicine we practice must evolve. Safer, non-invasive stool-based tests, which check for microscopic traces of blood, are now highly effective for screening and carry none of these risks. After 70, the wisest path is often to embrace less invasive strategies and to stop chasing shadows that may never materialize. Number 2. The fallacy of the annual full-body scan. There is a powerful allure to the idea of a full-body CT or MRI scan. The thought of a machine that can look inside you, from head to toe, and reveal every hidden secret seems like the ultimate form of proactive healthcare. It feels like you're taking control, getting ahead of any potential problems. The reality, however, is that for an older adult, this practice is more likely to be a curse than a blessing. While the intention is to stay ahead of disease, the most common result is a chain reaction of fear, anxiety, and a cascade of follow-up tests and unnecessary procedures that can diminish your quality of life, not extend it. Let's be perfectly clear. Full-body CT and MRI scans are not standard screening tools. They are incredibly powerful diagnostic technologies designed to investigate specific symptoms. Their power lies in their sensitivity. They can detect almost anything, and I do mean anything. This includes a vast number of harmless incidental findings that we in the medical field call incidentalomas. These are tiny, insignificant abnormalities, a small, benign cyst on a kidney, a harmless nodule on the lung, a shadow on the liver, that have been there for years and would never have caused you a moment's trouble. Your body is full of these imperfections. They are the marks of a life lived, but on a radiologist's report, they are flagged. That harmless finding now becomes a ticking time bomb in your mind, and a small spot here, a shadow there, and suddenly you are swept into a vortex of medical anxiety. This leads to specialist appointments, needle biopsies, and further, more invasive tests, all to investigate something that was likely never a threat to begin with. This is what we call overdiagnosis, and it is rampant. This is especially dangerous after the age of 70, because the body's resilience is not what it once was. A biopsy that would have been a simple outpatient procedure at 45 can now lead to a punctured lung, internal bleeding, or a stubborn infection in an 80-year-old. The emotional toll is also immense and rarely discussed. Instead of enjoying the health you have, you are now consumed with anxiety about what might be. I recall a wonderful woman named Valentina, 78 years old. She was vibrant and active. On a whim, she took advantage of a cheap full-body scan offered by a mobile clinic. The scan revealed a tiny asymptomatic lesion on her kidney. The word lesion alone sent her into a panic. Despite the high probability that it was benign and would never grow, the fear was too great. She underwent surgery. The operation was followed by months of a difficult recovery, a permanent loss of energy, and complications that never fully resolved. All for something that, had it been left alone, would almost certainly have remained harmless for the rest of her life. This is the tragic outcome of seeking certainty where it doesn't exist. True responsibility in our later years isn't about scanning for every possible flaw. It's about trusting your body, listening to its real signals, and understanding that not every shadow on a screen deserves your fear. Number 3. The overuse of cardiac stress tests. For decades, the cardiac stress test, walking on a treadmill while hooked up to an EKG, has been a cornerstone of diagnosing heart disease. The logic seems simple and sound. Push the heart to see how it responds under pressure. If there's a problem, it will reveal itself. But once again, after the age of 70, this straightforward logic can become deeply flawed and even turn against you. What was a useful diagnostic tool at 50 can become a misleading and dangerous procedure in our later years, especially for individuals without any active symptoms of heart disease. The primary reason is that these tests have a very high rate of false positives in older adults. This means the test suggests there is a significant blockage in the heart's arteries when, in fact, the heart is functioning perfectly well for its age. This happens because the aging process itself causes natural changes that the test can misinterpret as disease. Arteries naturally become a bit stiffer, blood pressure can be more variable, and the heart's electrical patterns can show minor benign variations. The EKG machine doesn't know you're 75. It just sees a deviation from the textbook normal of a 40-year-old and sounds the alarm. And what happens when that alarm sounds? It triggers the medical cascade. You are sent for a more invasive test, typically an angiogram, where a catheter is threaded through your arteries to your heart and injected with dye. And if a blockage is found, even a moderate one that isn't causing any symptoms and may never cause a problem, the pressure to do something is immense. This can lead to the placement of a stent or even a recommendation for open heart bypass surgery. These are not minor procedures. For an older adult, they carry very real risks: bleeding, kidney damage from the contrast dye, stroke, life-threatening infections, and long, difficult recovery periods. All of this can begin with a single misleading result from a routine treadmill test. I remember a 74-year-old retired gentleman named Gregory. He felt great, had no chest pain, no shortness of breath. But during a routine checkup, his doctor ordered a stress test just to be safe. The result was borderline abnormal. This led to an angiogram and the placement of a stent for a blockage that had never once caused a symptom. A month later, he developed a severe infection at the catheter insertion site and ended up in intensive care. His quality of life was shattered. Was it worth it? Leading cardiological associations now advise against routine stress testing in older adults who do not have symptoms like chest pain, pressure, or unexplained shortness of breath. True heart health after 70 is not found on a treadmill in a doctor's office. It's found in daily walks, in nourishing food, in managing stress, and in connecting with loved ones. Number 4. The cognitive risks of colonoscopy. Now, I want to revisit the topic of colonoscopy, but from a different, critically important angle that is almost never discussed: the risk to your mind. We've talked about the physical dangers of dehydration and falls, but one of the most devastating potential side effects for an older person is cognitive decline. The idea of bowel cancer is frightening, and for many years we've been conditioned to believe that regular screening is the only responsible choice. But we must honestly ask, what is the price of that screening? For some, the price is a piece of their mental clarity. The issue, once again, lies with the anesthesia. A colonoscopy requires deep sedation. As we age, our brains become more vulnerable. The blood-brain barrier is more permeable, and our neural networks have less cognitive reserve to bounce back from chemical stressors. This makes older adults highly susceptible to a condition called postoperative cognitive dysfunction, or POCD. Doctors see it all the time. After a procedure involving anesthesia, an older patient who was previously sharp and independent becomes confused, forgetful, and mentally foggy. This isn't just a brief moment of grogginess. This state of cognitive impairment can last for weeks, months, and in some tragic cases, it becomes permanent. Imagine sacrificing your ability to manage your own finances, to remember your grandchildren's names, or to simply enjoy a clear thought, all for a test that, given your age and previous clear screenings, had a minuscule chance of finding a life-threatening problem. The temporary peace of mind from a clean result is a poor trade for a lasting fog in your mind. Let me share the story of Eilina, a 78-year-old retired teacher. She had clear colonoscopies at ages 68 and 73. But at 78, her doctor mechanically recommended another one, just in case. She dutifully agreed. During the procedure, a rare but known complication occurred: a perforation of her bowel. She required emergency surgery and spent nearly a month in the hospital. She survived, but the combination of the major surgery, the extended hospital stay, and the anesthesia took a permanent toll. Her energy never returned, but more tragically, her sharp mind became clouded. She often told me, "I wish I had known that the cost of that test could be my very self." This happens because our medical system is often built on rigid protocols and habits. The guideline says, but guidelines are for populations, not for people. You are not a statistic. At a certain point, the focus must shift from statistical risk reduction to the preservation of what makes life worth living: mobility, clarity of mind, and emotional well-being. Number 5. The quality of life cost of cardiac tests. Finally, let's revisit the cardiac stress test, focusing on the true cost to your quality of life. We are all afraid of a sudden heart attack. We hear stories of someone who seemed perfectly healthy one day and was gone the next. This fear drives a powerful desire to find and fix any potential heart problem before it strikes. And so, stress tests are liberally ordered for people over 70, often as part of a routine annual physical. But the startling truth is that for an asymptomatic older person, these tests are far more likely to harm your quality of life than to save it. The problem is the cascade effect we've discussed, but I want you to see it from a human perspective. Let's trace the path of Gennady, a 76-year-old who loved gardening and playing with his grandchildren. He had no chest pain, no shortness of breath. A just-in-case stress test showed a minor insignificant abnormality. But that piece of paper began a journey. It led to an angiogram, which found some plaque, the kind most 76-year-olds have, but no critical blockage. Nevertheless, a preventative stent was placed. To prevent clotting, he was put on powerful blood-thinning medication. A few weeks later, he suffered a major internal bleed, a known side effect of the drugs. This led to hospitalization, blood transfusions, and a long, debilitating recovery. He became fearful of activity. His world shrank. His quality of life plummeted. All because of a test he never needed for a condition that was not threatening him. What we are learning now is that in older adults, our goal should not be to chase perfect-looking arteries on a screen. Our goal should be to preserve function and well-being. The scientific evidence is clear. For asymptomatic individuals, these routine tests do not reduce the rate of heart attacks or improve survival. They do, however, significantly increase the rate of invasive procedures and their associated complications. The most sensible approach is to listen to your body. Do you have chest pain or pressure during activity? Are you becoming unusually short of breath? Are you experiencing dizzy spells? These are real symptoms that warrant investigation. But if you feel well, if you are active and stable, your body is providing you with more reliable information than any machine. It's time to shift our mindset from aggressive, preemptive intervention to one of thoughtful, wise observation. To grow older is not to become helpless. On the contrary, it is the time to become wise. It is the time to question the system, to slow down, and to ask the most important question of all. Is this test or procedure truly necessary for me right now? In a world that glorifies more tests, more pills, and more procedures, the bravest and wisest choice is often to do less, not from indifference, but from a place of deep respect for your own body and your own priorities. Your medical care after 70 should not be an automated conveyor belt. It must be a conversation, a partnership between you and your doctor, centered on what truly matters to you. Is the goal simply to add a number to your years, or is it to add life, joy, and independence to your years? Blindly following protocols designed for younger bodies can rob you of your energy, your peace of mind, and even your life. Remember the conversation I promised you? When your doctor suggests one of these tests, you must be prepared to look them in the eye and ask these 3 powerful questions. First, how will the result of this test, no matter what it shows, actually change the way we manage my health? Second, what are the specific risks of the test itself for someone my age, and how do those risks compare to the risk of the condition we are looking for? And third, what would happen if we chose to simply watch and wait? These questions shift you from a passive patient to an active partner. They demand a thoughtful response, not a rote one. Your time, your energy, and your comfort are precious. You have earned the right to live on your own terms, not in fear, but with wisdom. Not burdened by procedures, but armed with knowledge. Knowledge only works when you apply it. I'm Professor Vitalis. Stay curious, stay healthy, and never stop learning.